नमस्कार दोस्तों, मैं हूं डॉक्टर गुलाब। आप सबका हमारे हेल्थ टॉक शो में स्वागत है। हर दिन की तरह आज का दिन है खास, क्योंकि मेरे साथ में है खास इनवाइटी। हमारी सीनियर है डॉक्टर स्नेहा। इन्होंने अपना BNYS SDM कॉलेज से किया। 12th बैच से इन्होंने अपना BNYS कंप्लीट किया। कंप्लीट करने के बाद में आज बैंगलोर में काम कर रहे हैं, पर आज फाउंडर डायरेक्टर हैं सामा वेलनेस सेंटर के बैंगलोर में। तो आज हम जानेंगे कि कैसे उन्होंने हार्डवर्क किया, और फाउंडर डायरेक्टर मतलब एक प्रकार से ये मान के चलें कि उसको खोजने वाले आप ही हैं। तो हम आपकी जर्नी के बारे में जानना चाहेंगे, पर उससे पहले मैं चाहूंगा कि ज्यादा देर ना करते हुए हम वेलकम करते हैं हमारे स्पेशल इनवाइटी आज के डॉक्टर स्नेहा मैडम को। मैडम, आपका बहुत बहुत स्वागत है हमारे शो में।
थैंक यू सो मच।
Yes, and my viewers are very eager to know your experiences, and my followers would like to know that how you came in field of naturopathy and did BNYS and reached to this position, and you are the one who is having the mastery over PCOD and infertility. So definitely we would like to know about the further more information on both the topics as an expertise. But prior going to the topics, I just would like to know that how you came in naturopathy field.
So after my +2, I really wanted to do something very different. I was inclined to do Ayurveda medicine. I definitely wanted to be a doctor. So when I was looking for Ayurveda colleges, I found an article related to naturopathy. And that's when I got interested in this, and my parents took me to Ujre, our college, and who will not get impressed after we see that beautiful campus and lovely people over there. So we really got quite inquisitive about the course, but we didn't know much about the outcomes of this course. Then we found out that Dr. Raghavendra Rao, who's now the CCRO and director, he is a family friend of ours. So then my father spoke to him, and we all got quite confident about, moving ahead in this. And that's how I started my course in naturopathy. And as I was studying, my most favorite subject was acupuncture. It was taught to us very well in SDM, and as well as I got quite astonished by the results we saw in acupuncture, and that made me study more about acupuncture. And I was always interested in gynecology, so I wanted to do something in the field of gynecology and obstetrics, applying the science that I know, that is acupuncture. So this made me, kind of go in more in depth into the system of reproductive medicine. So that's when I took up a course called Fellowship in Fertility Acupuncture, and this is a very streamlined and structured course which helped me to understand in depth about reproductive medicine, how to apply acupuncture principles to various issues related to infertility.
If we consider today's era, the women's health is, you can say, most neglected thing, because they don't take care about themselves and they take care about everyone. So I think today's talk we are going to dedicate to all the women for making the women's healthy for fit India. So this is the movement, and as you have done wonderful work in the field of naturopathy, we will just directly come to the women's health, and the most important thing, the burning issues in the conditions like where they suffer a lot, like PCOD and infertility. So I think that you can just go through the topic, and it will be very nice to know about the personal experience from you for getting the good cure regarding both the problems.
Yeah, so as you mentioned, today's women deal with a lot of things. There are multiple factors to look into, and they have to take care of themselves and their family around. they're always constantly subjected to multitasking. So it makes them to be, kind of neglect their own health and care. So this is why it becomes very important to kind of, give them a regimen where they can still take care of them and attend to everybody.
Yes.
So yeah, and it is very, very unfortunate to know that infertility and PCOD are on the rise. And we also come across many young girls and adolescent girls, who are kind of diagnosed with PCOD issues today. So it makes us, as a healthcare professional, for all of us, it is our responsibility to bring this kind of awareness as to how they can manage themselves and keep it under control, or probably solve this with simple solutions, not to kind of go into a lot of medications and not subject themselves into hormonal therapies.
Yes, yes, very true. As rightly said, if we will select the natural methods of treatment, then definitely we are protecting ourselves from the even the side effects of the medication, and we are working with the nature, because a woman is the creature of nature, and nature has created a woman like an delicate structure, you can say, where they face lot many emotional problems also. But the major problem regarding the women's health is the monthly periods, and most of that will be irregularized due to their lifestyle. So, can you have some highlights on the uh, PCOD, how it is affecting and leading to an infertility?
Sure, doctor. So I will just do a small presentation.
Yes.
It will help people to understand it more clearly rather than just talking.
Yes,
So
yes.
I'll just recommend, yeah. Is
Yes,
my screen visible?
yes, yes, visible.
So we would, yeah, so as I was talking to you about infertility, it is on the rise today, and we call infertility when couple are trying to conceive consistently for, you know, for about 12 months without contraception. So we will talk more about infertility, and before that, we will just first understand what exactly PCOS or PCOD is. PCOS, or polycystic ovarian syndrome, is a condition that affects women's hormone levels. So in PCOS, you see a lot of hormonal imbalance happening, and mainly it is the dominance of male hormones. Male hormones that are called as androgens. Now, every woman has a part of, male hormones producing in them, and every man has female hormones producing in them. But it should be such a way that a female hormones should be higher than the male hormones in a woman's body, and male hormones should be higher than the female hormones in the man's body. So in PCOD, what happens is there will be secretion or production of lot of androgens, or the male hormones, in the women's body, which leads to a lot of other side effects that we usually see, which are acne, excessive hair in the chin and other areas. So we call that hirsutism and all that. So these are all because of abnormal or increased secretion of androgens, or called as male hormones. So this hormonal imbalance or excessive production of male hormones results in skipping of this periods, or makes it very harder to come on time. And PCOS, now we see almost 1 in every 10 women. Uh, to know why should you actually get PCOD, we still don't know the exact cause of PCOD, but what we know, there are some hypotheses and kind of theories put forward, but they say that there will be some genetic predisposition for some girls getting PCOD. and there could be excess of insulin produced, and we call this peripheral insulin resistance. This usually happens in obesity, and PCOD also can be, you know, kind of having with low grade inflammatory pattern in the body. And some say that exposure to too much of plastic, that is bisphenol A, BPA, can also modify their genes and mutate their genes, and which can result into PCOD. So as we see here, the exact cause is unknown, but yeah, so there are several symptoms of PCOS that we get to experience, and through which we will get to know that one can have PCOS, and you can go to the doctor when you start having excessive hair, or you have skipping periods, you have irregular menstrual periods, you have fatigue for some reasons, and your abdominal fat starts getting higher, and you have acne happening, and you have male pattern hair coming up. So, and when you go to a doctor and they find out through the scan that there are some cysts or tiny follicles that are excessively, you know, situated on your ovaries. Ovaries are situated on either side of the women, and they will be able to find out through the scan if you have PCOS or not. It can also cause a lot of mood disturbances and premenstrual syndrome. All of this, you know, there can be a lot of mood irritability, everything associated with PCOS. Yeah. Um, this was in brief about how PCOS can come, and I would like to show you a few things about exactly, you know, the signaling delay that happens in PCOS, why there is skipping of periods. So usually, if you actually see this diagram, this is the brain structure of the brain here. There are two glands situated in the brain called as hypothalamus and pituitary. These are tiny peanut-sized gland. Gland is a tissue collection of cells which can secrete some juices which has hormones in them. Hormones are again less of hormones are again, you know, enzymes or proteins which have specific uh, actions in the body. Now these two glands which are there in the brain keeps giving signals to your ovaries which are situated in the pelvis. Now once they receive these signals, then in response to that, that we see some you know, the periods happening and everything. So in the beginning of the cycle you have periods starting, and then you have slowly, in response to the hormones, the endometrium going up, and then you have the hormones speaking up here again for inducing ovulation. Ovulation means the egg getting released in the women's body by about mid-cycle. Now again, you see the endometrium ripening in response to these hormones, and if the pregnancy happens, then the endometrium, that is the uterine lining, continues to thicken and prepare for pregnancy. If pregnancy does not happen, then it will all shred like this, like another periods. Now this kind of regular cyclical hormonal changes that we see is usually lost in PCOD because of lack of signaling or the connections between these glands working in synchronous with each other. So this is something that we needs to establish. It's called hypothalamo-pituitary ovarian axis, and that needs to get established to cure PCOS. Yes. So now, if you want to know more about PCOS or any other specifically, if you want to know, you can just let me know, Dr. Gulab. I'll be
So
able
the
to.
main thing what we can go for now, the management, the problem we have resolved, like there is a problem. Now what is the solution and how you are treating it in your clinic?
Okay. So in PCOD, actually, there are different groups when we see patients. One is obesity associated with PCOD. So we do come across patients who are obese and then they start developing PCOD, or vice versa, then absolutely the first management that we need to do is to advise them to lose weight and kind of help them with treatments to lose weight. And there is a section of PCOS patients who are lean as well, so we call them lean PCOS, who have strong genetical tendency or predisposition to have this problem. So their weight is totally balanced, and in fact they are lean, they come into lower BMI, but still they have PCOS. And the main problem of PCOS is that they are anovulatory, which means they do not have the egg getting released every month, which is why it causes infertility. Infertility because it causes lot of problems in conceiving, because they do not get the eggs released every month. So this anovulation is the main thing that we need to treat in patients with PCOS, and we need to make them ovulate. That is very important. And again, there are people with PCOS who have got regular periods and still having PCOS, and who have got irregular periods and having PCOS. So we must understand what is the category of patient that we are looking at. Now, to talk more about the management or the natural solutions for overcoming PCOS, of course, being a naturopathy doctor, I would strongly recommend having more of naturally adapted methods. Now these are some natural fertility solutions that I usually advocate to my patients. One is acupuncture. Acupuncture is a Chinese system of medicine using small hair-thin needles to put into the specific points. And these are connected to the electrical channels. We call it electroacupuncture. Now, when acupuncture is applied specifically to PCOD patients, it can result in stimulating the ovarian receptors and stimulating the activity, or activating the signaling mechanism that I was talking to you about. It helps in balancing the hormones, or probably inducing the hormonal rhythm that needs to happen. It also improves the uterine circulation and also helps in uterine progesterone secretion. It mainly helps in regulating their cycles. And mainly it helps in growing a follicle properly and achieving ovulation. So apart from acupuncture, of course, yoga is the best known science for PCO patients. They can have specific yoga module and practice every day to achieve the hormonal balance. Diet and nutrition is very important to be taken care here. Again, for lean PCOS, they have to gain a little weight, and for obesity patients, they have to lose weight. So we need to give them the right nutrition and dietary advice for these patients. And and we can apply hydrotherapy to them, and even the massage and aromatherapy. So I have a few things over here wherein these are certain acupuncture points that we use for PCO patients to help and regulate their cycles. And if in these COVID times, if one is not able to reach to the doctors, they can do acupressure to these points, where they can still stimulate these organs and the energy meridians that we call in acupuncture. And these are some of the self-treatments that they can do as well. Of course, yoga is something very, very important. There are certain yoga postures which can help in stimulating the ovaries. And this Sarvangasana especially will help in improving the signaling, the pituitary, hypothalamus, and ovarian signaling that we just described to you about. So this Sarvangasana is extremely good to improve the blood flow and also the hormonal balance. So these are some of the postures that they can do on a regular basis. Now coming to diet, I usually recommend for PCOD patients taking a lot of antioxidants to reduce the effects of PCOS. So antioxidants again reduce ovarian aging. It also helps in improving the egg quality. Uh, yeah, regular intake of proteins is very important, and phytoestrogens to balance hormones. They need to also take omega-3 fatty acids to reduce the inflammation in the body, and mainly select low glycemic index foods, which are mainly the complex carbohydrates, which are unpolished varieties of dals and cereals, and lot of fruits, which are very good to increase the the insulin resistance can come down once they take the low GI foods. Yes, one has to balance their diet very well to reduce the body fat percentage. So it is very important to take care of their diet and weight in control. One should make attempts to lose weight constantly and maintain a good body mass index, and always be on very regular with exercise and the diet and portion control mainly. And these are some of the hydrotherapy treatments that we usually advocate to our patients. This is hip bath, where they just sit in a bathtub, and I'm sure most of your patients have experienced this. It is a wonderful treatment to improve the abdominal and ovarian circulation, basically. Yeah, and this is hot and cold compress. Again, it can alternate applications of hot and cold can improve your blood flow to the pelvic organs, especially the ovaries and uterus, when applied on a regular basis. It can also release some cysts from the PCOS ovaries. Fertility massage, we usually advocate fertility massage or ovarian massage to most of our patients. We teach them how to do this. This is a self massage. They can use any aroma oils to massage their ovaries and uterus on a regular basis. Every day they can spend 5 to 10 minutes massaging themselves to your every day. Yeah, so we do advocate aromatherapy mainly to relax them from stress, and it also helps in stimulating the glands in the brain mainly. So we give them aroma oils specifically to improve their sleep pattern and also to reduce stress and anxiety. So in short, these are all the natural treatments that they can do to overcome their issues related to PCOD. And of course, one has to, really be aware of their ovulatory pattern and keep in touch with their doctors to seek help at the right time.
Very beautifully you have explained each and everything, and I think the most of things you have been covered very nicely. And just a few questions which I would like to take up from the live session. That usually these are the treatments when the person is suffering with PCOD or PCOS, or infertility it's due to because of that problems.
Yes.
Person has to go with these techniques for getting completely managed, and again going through the pregnancy or conceiving and coming to the normal pregnancy, because most of the time these are the somewhere these issues are the chronic issues. So how much time duration requires for all these treatment modalities to be implemented for a person?
Yeah, so it again depends on the degree of severity. Um, we all know that there are certain hormonal imbalance in PCOS. So there is something called as LH, which is luteinizing hormone, which is mainly the responsible, hormone for all the imbalance that's caused. Now, when we measure their LH on the second day of their cycle, we get to know where they stand. So how severe is the problem? predominantly high levels of LH hormone needs to be brought down, and it takes around 2 to 3 cycles of treatment to achieve lowering in LH. So once the LH is lowered or the LH comes to the normalcy, then the ovulation starts and their cycles get regular, and they can get pregnant, and yeah, they can get pregnant that way. Yeah. So LH balance is very important, and that's what we mainly aim at doing in our clinic too. So it may take anywhere between 3 months to 5 months of treatment.
So, if we talk about the main thing, like when you are talking about LH balance, so when LH balance is taking place, usually at that time, if we go through all these treatments, 4 to 5 months mainly it takes for coming back to the normal. But in condition where the holding capacity of the uterus, basically after fertilization of ovum, the holding capacity is weak. So somewhere I feel that exercise, is it important to do at that time, pelvic floor exercises? How about your view on that? Because
Yeah, thank you so much for asking this question. I think this is one of the main, questions that most of the patients will have in their mind, because they all have weight issues, and they will say, when do we exercise? Is it okay to exercise post ovulation? Yes, heavy, impactful exercises like aerobics, gymming, brisk walking, these things are extremely important cardio workouts on a regular basis to maintain and lose weight. It can be done safely in the follicular phase, that is, in the first half of your cycle. Once the ovulation is achieved, post fertilization, that is, like after, once you know that you're ovulated, you have ovulated and you have tried for pregnancy, you should stop doing impactful activities like aerobics or brisk, any brisk physical activities. But fertility yoga is very safe. Even after you ovulate, this will help you in implantation. So there are specific fertility postures, yoga postures, which can be very useful to achieve natural implantation. And it will also help in improving the progesterone secretion, which is, again, it can hold the embryo very well. And that is the only exercise that you can continue to do. The only practice, I would say, I would not call yoga exercise, it's a practice of mind and body. So fertility yoga with meditation and relaxation techniques is absolutely safe, and it should be done post ovulation to maintain and sustain a pregnancy.
So now, one important thing I'll ask, like when the when a woman is conceiving and they just wanted to have a baby, they have planned for having a baby. Now, in this condition, most of the girls, they would like to go with cesarean section. Actually, if I will say, they don't want to go for, but how to maintain and achieve a natural childbirth, and what are the important things which they can take care to avoid the cesarean. They don't want it to go, but that fear of pain, you can say, or you can say the complications, the fear of complications. So this, somewhere in the society, it has made that most of the girls, they go for the cesarean section. They don't want it to go with the pain and all other procedures. So what about your view on this, whether we are able to achieve the natural childbirth? As an expertise, you can put some points on that.
Sure, sure. Uh, Actually, it's all. There are a lot of other things when it comes to why there are more. More women are more subjected to cesarean sections these days, because they feel that natural birthing is a risk process involved. It can, and also there are a lot of other things involved there. But I would like to say that natural birthing has a lot of uh, uh, importance in terms of your baby's health, and the baby's natural immunity when it comes to immunity is something that is very key in required process, and natural birthing is something that every woman should give it a try to improve and nourish their baby's health and immunity. And nowadays the technology is very advanced, and there are a lot of painless birthing options. We have water birthing, and we can apply acupuncture for analgesia for painless birthing. And there are also a lot of other techniques and tools available to reduce pain during birthing process. So women need not get scared about it, and the recovery is much faster, and the life after birth and coming back to normalcy is much more quicker and faster. And natural birthing has a lot of health benefits for women as such, along with the newborn baby. So I think one should mentally and physically be prepared for doing this. I would greatly emphasize on practicing yoga at all times during pregnancy. It will make you strong-willed to face labor. There are beautiful labor breathing techniques you can practice during birthing process, which can reduce the pain. And of course, there are good yoga exercises which can keep your pelvic muscles strong and help you in achieving this normal labor easily.
So if you are following an natural, you can say if you are following the natural lifestyle, definitely you are going to uh, go through the healthy pregnancy. I must say that because somewhere your nutrition, your physical activity, and also the calmness of your mind and preparation for the pregnancy, these all are the important factors which you should consider when you are planning to go for an conceiving and planning a baby. These you can say the parameters should be taken care, and as rightly doctor suggested that one should have a proper diet and also some of the yoga techniques, because these are the things which are going to make your physic and mental, both the things healthy in healthy situation. And as the rightly madam suggested that acupuncture is one of the most important therapies nowadays to balance your hormonal imbalance. So the hormones which are being imbalanced, you can balance it with giving proper acupuncture. But definitely here I would suggest that if you take the acupuncture from an expert, this is always recommended. So prior going for choosing the physician, see that whether you can get good benefits. And here all the doctors which we are bringing it, they are graduates. They have done their graduation from an recognized medical college and recognized university, and they are pursuing, they have completed their BNYS, Bachelor of Naturopathy and Yogic Science. So they are the registered doctors, those who can guide you properly what things should be followed, what things should be avoided. And the most important from today's talk, what I can find out, that is the pelvic floor muscle exercise. If you strengthen your pelvic floor muscles, definitely the bearing capacity or holding capacity, even the muscle endurance power can be increased once you are going with the pelvic floor muscle exercise. So it was very nice talking to you, ma'am, after so long and in the Health Talk show. And really, I am so much thankful that you have accepted our invitation and come for the Health Talk show. And here I would like to thank you from my bottom of heart that like this in future, also please do come to our Health Talk show and share very nice things, very nice knowledge which you have acquired in over a period like 15 years. And this is what today's requirement. Give a right knowledge for the health, you will get good benefits, or right sentence like health is wealth. Right knowledge to health will give you always good wealth. So if you want to be a wealthy, think about first you need to be a healthy. because that is the first principle which you can achieve for being healthy. And I just request you, ma'am, if you can give some good tips to our viewers so that they can follow, or good message to our viewers.
Yes. Thank you so much, Dr. Gulab, for having me in this show, and I really appreciate your work for the society, and especially in terms of natural, health and wellness sector. So I would like to tell everyone that PCOD is manageable, and even infertility is a manageable condition. One should not stress themselves out and subject themselves to a lot of hormonal therapies unnecessarily, and always try to manage your problems in the most natural way as possible, and try to reach out to natural doctors who can help you with simple therapies that can improve the outcome, or mainly help you overcome your problems. It is very important to have a balanced and healthy lifestyle. So never leave out from exercising schedule. Always structure your diet. Give thought on what you're eating and how you're living your life, and make sure that you practice some good techniques to overcome anxiety, tensions that we are subjected to in today's world. So it is very
Yes.
important to lead a balanced lifestyle today to overcome these issues.
So very nice message that balance is your life. If you keep balance of food, if you keep balance of physical activity, if you keep balance of your thoughts, you are going to be healthy. No one is in this, you can say, in this stage of balance situation, no one is going to fall ill. So if you want to be always healthy, go with the balanced life. And balanced life only you can achieve by adopting naturopathy and yoga. Thank you so much, ma'am. And thanks for the followers, those who are viewing us live. Really, you have supported us in a great manner so that we are able to bring such a wonderful, knowledgeable faculties in front of you. And if you like today's video, don't forget to press the like button and also share it to the friends and families so that you can spread a nice or good message or right knowledge to your friends and families. And also don't forget to subscribe our channel, because today is the opportunity for getting regular updates. So if you subscribe the channel, you will get always good information updates from our channel. Thank you so much. Thank you, ma'am.
Thank you so much, Dr. Gulab. Really appreciate it.
Thank you.